It's been a week since I came here to treat this lady. She was complaining few little issue here and then, and she felt a little bit, you said wobbly when you were
Yes.
when you walk. In this week, she went to her usual Pilates class, and what you find out basically?
Well, she said to me that she thought my body looked straighter, that my shoulders were more relaxed, although she thought I still had a little tightness in the neck.
So basically, the Pilates teacher found out that she changed in posture. Last time I treat again an old injury on the hand, on the right one, and an implant. You had an implant with an implant on the right maxilla. That's it. I checked. I found out that there was after the treatment another treatment that had to be done today. The left knee, I will do the test again. I will do test here to understand if it's still free. Especially the upper part of the neck was quite tough. I will test again. I will go to the knee. I will show her how the L3 moves. I will treat the knee, and I expect a rebalance on the pelvis because L3 left side should be more flexible. Okay? Can we do it now?
Yes.
Thanks a lot. Okay. Okay. Is it comfortable, the position?
Will be in a moment.
Okay.
Yes, that's okay.
So, I redo the test again. I go to the neck and I expect that left and right is completely different. So, that is completely different than when I felt it at the beginning. The top right part was completely stiff. Now it's not stiff anymore. Okay. What I feel is generally the left side is a little bit harder. So this is the right, this is the left. Do you feel a little bit harder here?
Not
This
really.
side. Okay. Shoulder, I move the shoulder down, I move this shoulder down, it's a little bit more stuck, let's say. Let's go to the most important bit, the pelvis. I will lift the pelvis left and right, as usual. This is the left, this is the right. Okay, a little bit of difference. This side is more light, this side is a little bit heavier. Now the most important, L3. I already know it's there because I checked last time. L3 should be completely blocked. This is L3 and it's blocked. You feel it doesn't move at all. The other side, you feel how it moves? So L3 has a concavity toward the left. This is an irritation from the replacement. Knee left, knee replacement. It is normal. This is a normal behavior after an operation. Every kind of operation. That you remove a mole or you have a joint replacement doesn't matter. Everything will give you a sensitization, so a restriction on the spine. The restriction on the spine over the time, an accumulation of injury over the time will make your posture to change. So you will lean more on a side, you will lean more forward. So getting older doesn't mean that you need to be okay in having pain and be used to it. No, you have more time. As long as you get old, you accumulate injury. So the injury sum on top of each other and change your posture in a series of combinations that is not important now to unveil in this video. Injury there, release is still good. Very severe restriction, L3 left side now. I already know the knee is the aim of my treatment today. This one is the right one in which she had a partial knee. This is a total knee replacement, okay? Total knee replacement. The mobility, to be honest, this one seems more well, they both have a lack of extension, okay? Also, we forgot to tell, she had a blood clot on medication, okay? She's under medication for a blood clot. Now, again, L3. Let's confirm. Deep breath. Please take a deep breath. Okay, So when she breathes, literally L3 moves this way. The leg is like if it shrink. What happened if I try to pull the leg? I will do from here because he had this problem, the block clock on the bottom. If I try to pull the leg on the bottom toward the feet, this side moves a little bit more. This side is completely stuck. Do you feel movement? Did you feel any movement here? It's a very little one, but you need to feel this area here of the pelvis. If I pull, moves a little bit, it goes down a little bit. You feel? This one doesn't move at all.
That's right.
Zero. Okay? So the pelvis is like that. It's a little bit higher on the side. Okay, I already know what to do. I know since last week. We will do it today. I will retest. The test will be obviously L3. It has to move on the right, pelvis more aligned, because she mainly has some discomfort on this part of the back. Mainly. She had other injury, but mainly this is the major discomfort. We will see if the pelvis will realign. This is the right, and this is the left. So the left side a lot more light than the right one. For the moment is everything. I will open the camera again after the treatment is ended. Okay, I opened the camera again before the treatment because I wanted to show the behavior of the leg. Look at this difference. The right one look a little bit more relaxed. This one look a little bit more stiff. It's the mobility of the hip, the sternal rotation, due to the fact that the pelvis is right twisted. Obviously one leg come up a little bit. It's unable to go on the external rotation. So this is the sternal rotation a little bit stuck. This is the sternal rotation, more loose, but if we go on internal rotation, this is the internal rotation, it's quite good. And this is the other one, it's a little bit more stuck at the end of the range. Okay, so when a movement, as the hip rotation is more stiff, the sternal side on one side, and the sternal rotation on one side and the internal rotation on the opposite side is an imbalance. We can only talk about a postural problem. This is what happened all the time. It happened for everything. Shoulder impingement, for carpal tunnel, tennis elbow. You will see that left and the right are completely different. If you do a test, which you will see in other video, left and right side work completely different. The treatment is finished. I had to treat the knee, it's true, but also after the knee, immediately I felt the problem coming from the hip. So I treat the knee, L3 released a lot. So now the lumbar spine moves a lot more left to right. Immediately the pelvis twisted even more because of the problem here. I treat this part and now this is the result. When I lift, just relax completely. When I lift the pelvis, it is a lot lighter, and this side is similar. Still not 100%. I already know the new condition. So after the knee, I went on the head. On the head, I felt this is the part connected, the upper. Is the part connected with the pelvis. So there was a big rotation around the very top of the skull. Okay, I went there. I treat the operation. Let's say the operation for the replacement. After the treatment, the pelvis released a lot. Now, when I touch the skull moves down, and it moves toward the jaw. Now she has a misalignment on the jaw. She also wear braces because she had what we used to refer as a third class. So she had the jaw moved a little bit. So she used to have the braces when she was around 20. Yeah, around 20.
Yeah, when I was younger. In a teenage, I think.
Ah, teenage. Okay, so she was younger than that. Now the neck is still good. It's still good. The lumbar spine is hard to see on camera, but Before she had a lot of pain when I was moving the lumbar spine. Now moves a lot better. While I was treating the hip, she had to go to the toilet twice because a realignment on the toilet creates definitely more space for the bowel. So a lot of noises, you know, when you feel the blow, 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 that noises, which people think, oh, I'm getting hungry. It doesn't mean anything. It's not that the reason. Those are sound that the food inside the bowel does when it find the bending of we have 7 to 8 meters of bowel inside our abdomen, so you can imagine how hard it can be, especially if you have a tight, let's say a tight pelvis. So there was a realignment. She had to go to the toilet. Very good. This is a very good finding. Definitely there is a difference. She feels the difference now. If we compare to how it was before, the foot improved as well. Let's check. This is the position of the foot. It's not perfect, but definitely is better than before. So if I move this one and this one, now they are more similar. Okay, before there was a big difference. This one was a little bit more stiff in external rotation, and the other one was stiff in internal rotation. Now they are more similar. Again, we will wait next time for the feedback. We will check what's going on. I will do the test again, and definitely we can go for the treatment on the jaw. For the moment, thanks for watching.